Our presentation is on communication. I will be covering the different tools of communication. Cami will be presenting on effective communication. Hannah will discuss ineffective communication, and Deborah will close with discussing benefits of communication. According to Catalano's Nursing Now, Today's Issues, Tomorrow's Trends, the nursing profession recognizes communication as one of the cornerstones of its practice. Why communication? Nurses must be able to communicate effectively with not just patients and families, but all other interprofessional members of the healthcare team to deliver high-quality patient care. Who is involved? There are many people involved in the communication process in the healthcare field. Patients, family members, nurses, physicians, case managers, and therapists are to name just a few. Throughout our presentation, we will discuss different tools used to communicate, benefits of communication, and effective and ineffective ways of communication. There are many different tools we can utilize to communicate within the healthcare profession. It is essential we use these tools so that we ensure to deliver safe, proficient, high-quality care to our patients. We are all familiar with the SBAR form of communication. As a reminder, this covers the situation, background, assessment, and recommendation of the current situation you are dealing with. Communication using the SBAR method has been used among the healthcare field now for many years. When nurses use the SBAR technique, it has proven to improve communication among the team and ensures the patient's safety. As we know, the SBAR is used among nurses during bedside report handoff for shift change. It is also used among the nurse and a physician for communication regarding a change in a patient's status. Call lights. The use of patient call lights is essential to patient safety and communication between the patient and nursing staff. Call light technology allows the patients to request information or help from the staff when needed. There are different reasons for call light use. Pain management, turning and repositioning, falls or accidents, and toileting are to name just a few. It is important we, as nurses, answer these lights as efficiently as we can to ensure patient safety. Documentation through charting is an essential component of communication. It is crucial that we, as nurses, chart actively and honestly in a timely manner to ensure patient safety and to help communicate with others on the healthcare team. Charting provides documentation of things such as medications administered, procedures performed, interactions between the patient and members of the healthcare team, and laboratory and diagnostic test results. Translators. Language translators or interpreters are a key component of communication between individuals of different cultures and ethnicities. These translators can incorporate both verbal language and sign language. In the healthcare field, it is our due diligence as nurses to provide language interpreters to individuals when needed to provide safe and accurate care. This communication tool is necessary for an individual's understanding of their plan of care. Communication between nurses. As you may have witnessed within our local healthcare facilities, nurses have several tools to communicate amongst each other. These tools help provide safe, effective care to the individuals of whom we're caring for. You may have observed nurses using work cell phones, earpieces, voceras, and walkie-talkies to communicate amongst each other in the healthcare facility. These modes of communication can all assist in the care of our patients. For example, you may need an extra set of hands or extra needed supplies when working in a patient's room performing a dressing change. You might be able to use one of these forms of communication to call for assistance. Communication is essential in the healthcare field. Utilizing all available tools of communication creates better patient outcomes as well as a better work environment for all of the healthcare team involved. The previous slides describing tools of communication are only beneficial if used in the appropriate manner. For instance, effective communication encompasses better learning and receiving strategies. Without quality communication between healthcare professionals and to the patients, healthcare costs would rise, and so would negative patient outcomes. All healthcare professionals must be able to communicate clearly and effectively to be able to provide the best possible care. These are just 10 of the communication skills I find most effective when it comes to healthcare communication. I will be discussing what each one means in terms of effectiveness and how that can be applied to the daily job of nursing. This picture describes communication as being a two-way street. For the communication to be effective, you will need both an active listener and an active receiver. Both parties need to hold up their end of the conversation, literally and metaphorically. Therapeutic communication is extremely important in every aspect of the healthcare field, but especially nursing. As a nurse, effective communication with patients, their families, and all others in our interprofessional team is of utmost importance. These are just a few examples. Whenever possible, communicating face-to-face is the best possible way to interact. This is because you can acknowledge any nonverbal cues the receiver may make, and nothing will get lost in translation. It also allows for a better conversation and not just one person doing all of the talking. The way you speak also has an immense impact of the effectiveness of the conversation. It is important to keep a lower pitch, especially if the patient's hard of hearing, pause when necessary, and do not rush through the conversation. Listen to the speaker's tone of voice and adjust as necessary. Positive nonverbal feedback, such as the nodding of one's head and frequent eye contact, can help the communication become better interpreted on both sides. If a patient's not fully grasping a concept, they may not say anything, but their eyes will squint and their forehead will wrinkle a little. Sit openly and make frequent eye contact whenever possible. Ask open-ended questions, talk less, recognize nonverbal cues, and favor your right ear because the left side of your brain contains primary centers for speech comprehension. If talking to a patient, the likelihood of them understanding and absorbing the medical lingo is usually lower, so try to talk in layman's terms whenever possible. Go over any information that you may have thought the receiver did not completely absorb. I think having patience is one of the most difficult skills to acquire and might take practice. Utilizing deep breathing is a way to relax yourself. Breathing in from your nose and breathing out through your mouth, each to a count of 4 seconds, can reduce your anxiety. Being respectful to all people you're communicating with allows for a more appropriate communication between all parties. It also allows for more receptive listening on both sides. Respect builds trust and safety in professional relationships, and it means accepting another's opinion. Pictures are a great way of explaining and reinforcing what words cannot. If a patient is coming out of surgery, for example, chances are they're not going to remember what post-op instructions you tell them. So having a pamphlet is great for reinforcing information and allowing for more effective communication. Asserting yourself helps to boost decision-making skills and makes for a clearer understanding of the topic at hand. If you come off as shy and unsure, whoever you're talking to will instantly regard that as, you have no idea what you are talking about. Humor is only effective in some cases. It relieves stress and makes for easier communication between all parties involved. Humor can allow for a more inclined listener engagement, but this does not mean you always have to produce the humor. When you feel if you have said everything you need to say, it is important to make sure your listener has received everything you were trying to convey. You can do this by paraphrasing and asking your listener questions about the information they have just heard. To be credible entails having a direct and accurate persona. To coordinate encompasses delegation and leadership skills, and collaborating with your interprofessional team using concise language, and by staying positive and advocating for your team, they will do the same. Having multiple people to rely on is something you need, or vice versa. When going on a lunch break, it's important to communicate your patient's needs with the nurse that will be looking after them. This will decrease the potential of falls and other safety issues. When communicating with other healthcare professionals, it may help to use ADPI. This will incorporate the clear and concise language as well as assertion and respect. This encompasses all healthcare professionals. Effective communication with patients is solely based on trust and understanding. The more you listen to them, the more they listen to you. By having patients collaborate in their care when appropriate, this gives them independence and increases their trust and respect for you. Communication is the most important part of any healthcare decision, and without communication, how would we know where to bring Jerry,
or when Jan is supposed to get her medication. But this is only done if we utilize effective communication properly.
This is my presentation on common ways nurses can display ineffective communication with their colleagues and patients. According to the University of Texas, it is estimated that 60 to 90% of communication is unspoken. In other words, we rely heavily on nonverbal cues to interpret what the speaker is relaying to the listener. According to Brand Astic, eye contact demonstrates respect and understanding. A lack of this denotes a lack of respect and understanding, which is always harmful toward effective communication efforts. Imagine you were asking a fellow colleague about taking care of your patients while on break. What would you think of if the colleague responded to you with the posture illustrated above? How would you respond? Not only does eye rolling indicate a lack of respect, but it is also highly unprofessional and does not build trusting relationships. I'm sure we all have experienced this reaction from someone, especially in stressful situations. Turning out or turning away indicates to the sender the information that what they have to say is not interesting or important. If the person on the left were to verbally speak, they would probably say something like, "Are we done here?" Verbal communication is what most of us think of when we hear the word communication. And the following slides are some examples of how verbal communication can be ineffective. Automatically, we want to match how a person responds or reacts to us, even if this response is not kind. An effective way to avoid responding to someone in a defensive manner is to always be aware of your emotions before responding. Verbal interruptions can happen easily if we are not aware of what the person is saying. Take time to listen before responding. The goal of the conversation is to gain understanding, not to wait for your voice to be heard. Which statement from the nurse would help elicit the best response from the patient? Asking, "Do you know it is not a good idea to smoke?" Or, "What do you know about the health impacts from smoking?" Clichés are not helpful in the clinical setting. It is common when clichés are used for the patient to feel like what they have to say is not important. Same goes for stating opinions. When a nurse states an opinion, this commonly does not help the patient. Paraverbal communication is about the emphasis one places on words, tones, and pauses in what they are communicating. According to Catalano, paraverbal communication is another key factor that goes into how we communicate. Under high-stress situations, nurses can fall into the habit of ordering. Telling others what to do in an impolite way demonstrates that the speaker does not care about the thoughts of the other person and takes away the need to understand others. Threatening is another ineffective paraverbal technique that naturally causes others to become defensive. This can lead to a toxic work environment for everyone involved. Name-calling is not only offensive, but unprofessional and unproductive. This tears down valuable connections with colleagues and may increase the risk of patient safety due to a lack of colleague collaboration in order to keep a patient safe. Rapid talk is a defense mechanism that usually denotes stress or avoidance of someone or something. Effective communication and understanding is vital, especially in healthcare-related jobs. Another factor that plays into ineffective communication that Catalano includes are environmental factors. In the hospital or healthcare context, what are some surrounding attributes of the work environment that can make communication difficult? Some examples of common contributions to a stressful work environment include vertical or lateral violence, unresolved personal conflict, pay cuts, and elevated patient-to-nurse ratios. Tobias states, "Our preconceived attitudes affects our ability to listen. If we come into work with a heavy load of emotional burden, this will affect our ability to listen to others and the quality of patient care that we give." Being mindful of your needs first will assist you to give the best of yourself to your colleagues and patients. and this in turn will affect your quality of communication.
Here we will begin to talk about the benefits of communication between patients and interprofessional. Communication with patients begin with the nurse at first contact and lasts as long as the therapeutic relationship exists. As my peers stated before, communication must be effective. Courtesy and kindness are required on the healthcare provider's part from the beginning to help the patients begin to feel comfortable. Patients need to feel like that you care and that you are listening. They may feel more open to disclose more information about how they're actually feeling and not feel as they are being judged. Good communication builds trust and rapport between patients and professionals. An RN must take time to try and understand any problems or concerns the patient may have. According to an article from the University of New Mexico, patients who feel they are receiving all of their nurse's attention may disclose the true extent of their symptoms much faster. With good communication and listening skills, a nurse can better advocate for the patient or help the patient address their concerns, which would lead to them being more involved in their care. Communication leads to more accurate diagnosis. Patients who understand what's going on with their condition are more likely to understand why treatment is important and possibly follow their medication regimens. Communication can lead to more realistic patient expectations. Knowing the expectations of our patients can help avoid the disappointment and anger, and also avoid our exposure to liability. As mentioned before, patients will have better adherence to treatment. Patients are more willing to be compliant with treatments and medication when healthcare professionals have thoroughly communicated with the patients the importance. The patient feels that the healthcare providers are being responsive and empathetic to their condition. This provides a better grasp of what's going on and will promote the patient to seek further care. With patients seeking further care, this entails interprofessional communication. This can satisfy the innate needs of the patient as it follows in Maslow's hierarchy of needs. Interprofessional communication helps improve patient care because each team member provides a different aspect, a unique perspective, and a valuable insight on what's going on with the patient. It also reduces medical errors. Clinical communication with pharmacy is very valuable in reducing medical errors, adverse reactions, and mortality rates. It also ensures the nurses have everything they need to treat the patient. According to the Joint Commission list of national patient safety goals, getting important test results to the right person on time is a required standard. Interprofessional collaboration within healthcare helps prevent medical errors, improves patient experience, and increase patient outcomes, which all leads to decreased healthcare costs. According to an article from the University of New Mexico, nurses who communicate well with their coworkers tend to witness an improvement in morale as well as job satisfaction. So just to recap, fast, high quality, effective communication must happen amongst patients, family members, and interprofessional healthcare teams. Effective communication, whether it be therapeutic, face-to-face, or verbal, should always include active listening and efficient feedback, and written material should always be provided. Also, ineffective communication may not always be intended. So keep an eye on your body language and the environment in which you are providing any teaching or providing any patient care. Always remember that the benefits of good communication within the healthcare field outweigh the bad, and good effective communication is very beneficial to all people involved. Thank you.